In today's rapid update video, we'll be going over the guidelines side-by-side for surveillance of Barrett's esophagus. This guideline side-by-side looks at recommendations for Barrett's esophagus, also known as BE, from the American Gastroenterological Association, also known as the AGA, and the American Society of Gastrointestinal Endoscopy, also known as the ASGE. The recommendations in this guideline side-by-side are divided into categories based on screening for Barrett's esophagus, surveillance endoscopy, wide area transepithelial sampling, endoscopic ultrasound, volumetric laser endomicroscopy, and biomarkers. In today's rapid update, we'll just be going over key takeaways, so to get the full side-by-side, make sure to check it out on guidelinescentral.com. Starting with screening for Barrett's esophagus, both the AGA and the ASGE suggest screening endoscopies for at-risk patients. The AGA specifically recommends against doing a surveillance endoscopy in patients with columnar-lined esophagus less than 1 cm with intestinal metaplasia because of the low risk for progression. Now going into wide area transepithelial sampling, or WATS 3D, the AGA does not recommend for or against WATS 3D in addition to tissue sampling using a structured biopsy protocol. The ASGE suggests that WATS 3D may be used in addition to tissue sampling with the Seattle biopsy protocol to increase the diagnostic yield. For endoscopic ultrasound, also known as EUS, the AGA did not address the use of EUS. The ASGE recommends against the use of EUS to differentiate mucosal versus submucosal disease. As for volumetric laser endomicroscopy, also known as VLE, the AGA did not address the use of VLE, and the ASGE was unable to make a recommendation for or against the use of VLE. And last, the section on biomarkers, p53 gene tests, and tissue cipher testing. Biomarkers were not addressed by the ASGE. The AGA was unable to make a recommendation for or against the use of p53 testing and tissue cipher testing. Although alteration in the p53 tumor suppression gene may increase the risk of disease progression in patients with BE, it's unclear at this time how the results of p53 testing should be used to guide management. More studies are needed to determine if tissue cipher testing can accurately predict progression in patients with BE. And there you have it. Make sure to check out the full guidelines side-by-side and other clinical tools at guidelinescentral.com.